Hello, everyone. I'm Dr. Naomi Murray with Clinicians Brief, and I'm excited to welcome you to today's webinar, Enhancing Your Practice with Hyperbaric Oxygen Therapy. Before we begin, I'd like to take a moment to help you familiarize yourself with the webinar platform. You can rearrange your console to your liking by expanding or shrinking the boxes on your screen. If you want to bring something back up that you have minimized, use the icons at the bottom of your screen. This presentation is both live and interactive, so you can ask questions at any time by typing a question in the presentation window on the bottom right side of your screen. If you have any technical difficulties, please alert us by submitting your concern in the presentation window, and a member of our support team will work with you to correct the issue. This webinar is approved for 1 hour of CE. Please refer to the instructions in the top right of your screen for obtaining your CE certificate. After viewing the webinar for at least 50 minutes, you can access your certificate for 1 hour of race-approved CE by clicking on the yellow icon in your toolbar. You'll also receive your CE certificate via email upon the conclusion of today's event, along with a list of 5 key takeaways from the webinar. This event is available today with support from our industry partner, Sechrist. And joining us, sharing their expertise, is Dr. Neel and Dr. Deepan Kishore. Dr. Neel is the CEO, founder, and president of Neel Veterinary Hospital, which is currently the only location in the state of Oklahoma to offer hyperbaric oxygen therapy and was also the first 24-hour veterinary facility in Oklahoma. Dr. Kishore is the research director at Neel Veterinary Hospital, where he performs several soft tissue, orthopedic, and minimally invasive procedures. Dr. Kishore has played a vital role in bringing new technologies, particularly hyperbaric chambers, to Neel Veterinary Hospital. I know I'm very excited to learn more on this topic, so without further delay, here's Dr. Kishore and Dr. Neel.
Hi, I'm Dr. Kishore. I'm going to talk to you about hyperbaric oxygen therapy. So, question is, first, what is hyperbaric oxygen therapy? How does it help? Is it approved in dogs and cats? So, this is a very safe and approved therapy in dogs and cats, and there's recent papers that came out saying how safe this procedure was. Second, there is a very nice chapter on internal medicine textbook, or all the good internal medicine textbooks, and Ettinger to give us the uses and benefits of hyperbaric oxygen therapy. So, hyperbaric oxygen therapy is basically 100% oxygen delivered under pressure, 1.5 to 3 times that of normal atmospheric pressure. And the treatments last between an hour or hour to hour and a half, but usually about an hour, and they're given about twice a day. They can be done more frequently, but usually no more than, you need to have 4 hours between treatments. So when we say high pressure, there's a lot laws of physics involved. You know, that's the Henry's laws of gas behavior, where they say the solubility of the gas is basically proportional to its pressure. That's what this hyperbaric is doing. When you increase the pressure, becomes more soluble, and that's therefore pets get more oxygen, okay? And there's a lot of data going around, you know, in healthy room air, you know, at sea level, hemoglobin saturation is more than 97%, you know, and oxygen concentration is about 0.3 mils per deciliter. However, when you increase the atmospheric pressure of oxygen, you know, and with 100% oxygen in the hyperbaric chamber, this oxygen concentration jumps from 0.3 mils per deciliter to 6 mils per deciliter. So there's a very, very, very high level of oxygen going into tissues, you know. This can meet all the resting cellular requirements in a pet, okay? And this is being used in people, you know, for some religious reasons. If they can't do blood transfusion, they'll put them in hyperbaric chamber to give them oxygen, even if they don't have enough red blood cells. So most patients do not require any sedation. They will just go in a chamber very comfortably. And the Sechrist chamber is pretty cool. You can actually pick up the phone and talk to the dog and say, hey, dog, call him. and talk to him, and that's very, very comforting. Even if the dog seem a little, or cat seem a little bit more, apprehensive to go into the chamber. In our hospital, we usually determine number of treatments by the disease process and the patient response. Okay, so like I said, during hyperbaric oxygen therapy, we deliver very large concentrations of oxygen in the plasma. Okay, this is when I won't go into the details of physics, but the second law comes in. It's the Fick's law. Basically, what it says is increasing partial pressure differences increases gas diffusion distance as well. That's what we use in the second thing. The oxygen can diffuse 4 times deeper into tissue than oxygen carried by red blood cells. That's by applying the Fick's law. And with using this law, oxygen is delivered into diseased or wounded areas of the body, and again, offering increased regeneration to tissues and decrease in inflammation. This is very vital because, like when you're treating a wound, yes, you don't always have very good blood supply, so the Fick's law helps at least to ensure that we get enough oxygen to those tissues. So why do we use hyperbaric oxygen therapy? Delivering oxygen in high concentrations under pressure, you accelerate the healing, wound healing, and we also have a bunch of anti-inflammatory properties that is not possible under normal physiologic conditions, and that is very unique to hyperbaric oxygen therapy. So what does hyperbaric do? It reduces swelling and inflammation. There's a lot of proposed mechanisms, and I'll go over that. And there's stimulation of new blood vessel formation into the healing and inflamed tissues. There's reduction in pressure and edema caused by head or spinal cord injuries, and stem cell multiplication recruitment to damaged tissue. So this is how hyperbaric works. The way is, chemokines, those are the factors that basically attract your inflammatory cells in there. So hyperbaric, there's papers published that hyperbaric therapy has effects on the chemokines, TNF-alpha, tumor necrosis factor alpha, and some major histocompatibility complexes as well. And it also aids in angiogenesis and stem cell multiplication. And all of this has been published. So when you put that into practical use, these are the most common indications that we use hyperbaric for. I'm going to go into individual conditions, but that's a gist of the pathophysiology as far as how hyperbaric therapy works. So indications, post-operative swelling, just thinking about, you have swelling, so we have all our pets go through, from hyperbaric before and after spinal decompressions, TPLOs, bone procedures and everything. Head and spinal cord trauma, smoke inhalation is another one. Carbon monoxide toxicity, FCEs, and pancreatitis. That's been a lot of interest in pancreatitis in the human side, in the lab animal model, in dogs and cats and everything like that. So when I talk about these conditions, I'm not trying to say, you stop all your other treatments and do the hyperbaric therapy. Hyperbaric therapy is a great form of integrative medicine. You do everything you do and add hyperbaric therapy that's when we see the best results. When I think about pancreatitis, I think it was end of last year, we had a dog come from the West Coast, treated at a specialty center. Diabetes was never controlled. Pancreatitis was never controlled. They were driving by, and they were moving to Oklahoma City, so they stopped here in our clinic and said, we have never had it controlled. It was seen at she called him gastrointestinal specialist, but an internal medicine specialist, and she gave me all the treatment protocols. We hospitalized the dog because the glucose was high. We did literally everything that the internist had done in the past 6 months, and the only thing we added was hyperbaric therapy. We were surprised. For 6 months in a row, at least when I followed up, the dog's blood glucose was between 100 and 180. Pancreatitis was controlled. And the most interesting fact was the owner of the pet had done some work with hyperbaric therapy in people relating to autism. So she was very thrilled. So we see a lot of practical cases like that. When you integrate hyperbaric therapy to your pre-existing therapies, we see some excellent results. Same thing with immune-mediated diseases. Snakebite trauma, there's a lot of interest. Neel Veterinary Hospital participates. Dana Call runs the study with University of Tennessee to see if there is benefits, and if there are, how much of a benefit you get with snakebite trauma. So we're proud to be partners with University of Tennessee in that study. Thermal burns, Dr. Neel is going to show you some really good pictures on thermal burns later on. Sepsis, there's proposed mechanisms on sepsis as well, as far as how it helps in septic conditions. The only thing, challenge with septic dogs, if we have them on blood pressure medications and everything, we have to make sure that they're getting whatever medications that they need when they're in the chamber. So when that can be a limiting factor in some cases, but once they're more stable, we definitely put them in the chamber because of the antimicrobial effect, inflammatory modulation, and enhanced neovascularization. We believe those three principles help with dogs and sepsis. Again, drowning cases, strangulations, non-cardiogenic pulmonary edema, or other conditions as well. So how do you incorporate hyperbaric therapy in the practice, and what do you tell clients? For example, pancreatitis, I said, we'll do everything we do for pancreatitis, your fluids, your, of course, workup, pain management, if they need tubes, and all that, then add hyperbaric therapy and explain to the benefits. Same thing with IVD. Pancreatic abscesses, again, those three things, anytime you have an abscess, those principles of antimicrobial activity, hyperoxygenation, inflammatory modulation, and antimicrobial synergy come into play. And that's when we talk about intracranial abscesses, pancreatic abscesses. This is a great addition. Sepsis, like I told you, edema in the liver or kidney. In preoperative, for example, if you're going to do a stenotic nares or soft palate dissections, we pre-oxygenate and oxygen helps, 100% oxygen helps even better. So we do hyperbarics on brachycephalic dogs. These are anecdotal, but we believe it helps, and certain types of cancer therapies, of course, anemic dogs as well. Most of our orthopedic surgeries, pre and post-op, we do hyperbarics. And it also helps with pain. So hypertrophic dystrophy dogs, like I said, soft palate dogs, we definitely use hyperbaric as well. And reperfusion injuries, carbon monoxide toxicity, cyanide toxicity, again, those are other indications that can use hyperbaric therapy for. So what are the contraindications of using hyperbaric therapy? So fever is a contraindication about 103.5, but the most important contraindication for HBOT is pneumothorax. Of course, increasing pressure and putting a lot of oxygen, you don't want that when you have undersolved pneumothorax, tension pneumothorax, or pneumomediastinum. If we see pneumothorax, we'd avoid hyperbaric at all costs. That's when we have these hit by cars, we always make sure you get 3-view X-rays. Make sure that they are they don't have pneumothorax before they go in the chamber. Alcohol, of course, petroleum-based products, not the best idea to put them in the cage when you have oxygen and with a bunch of petroleum in there. So, and with opioid medications, we say just wait for the half-life clearance. If you do a TORB or slower dose of butorphanol to prevent anxiety, that should be okay, but they can cause respiratory depression. So we don't want to do very high doses of opioid medications and get them in the chamber. Seizures, there's potential that hyperbaric could lower seizure threshold. So whether they're controlled or uncontrolled, we recommend that we do not place pets in the hyperbaric chambers if they have seizures, And certain types of chemotherapy medications, the ones that are listed, we recommend that it's avoided, so we don't place them in the hyperbaric chamber. Other precautions of unmanaged hypoglycemia, of course, if there's a Sechrist, the new machine has a way where you can do IV fluids and give them dextrose support during treatment. In that case, it can be okay, but there are other chambers where you can't do any type of fluid support when they're in the chamber. So in those cases, if they're hypoglycemic, you got to watch out. Claustrophobic pets, of course, there's a dog that would not want to do anything you want them to do. Butorphanol might be a good choice to just give mild sedation, just enough for them to be comfortable in the chamber. Oxygen toxicities, it's a rare risk factor. It can happen, but it can cause focal or generalized seizure in the chamber. I can recollect a case that I've seen. We looked, and I think we have offered more than 3,000 treatments in this hospital, and I don't think we have had any focal seizures that I can think of, at least in my cases. And ideal humidity is about 25 to 35%. So this will prevent static buildup within the chambers. And again, one more thing: any condition that causes air to be trapped inside the body, pneumothorax, undersolved GDV, otic diseases, you just have to exercise a little bit more caution. Big take home is don't put them in if they have a pneumothorax. So with this, I'm going to have Dr. Neel take over. Our experience with hyperbaric is it seems, there's a lot of publications that are out there that come up and say, well, it helps, and others say, well, it's very safe, but we have seen partial difference or no difference. And I've used hyperbaric in one of our recent studies that we partner with another school. We believe, especially in the face and oral cavity, the hyperbaric seems to be very, very effective, with any type of oral wounds, lacerations. Again, the oral cavity has enhanced blood supply. There's a lot of papers that have come out in 2019, 2020 talking about the benefits of hyperbaric therapy in dental implants, promoting osteogenesis, and all that good stuff. So we believe that there might be some regional differences as well, how it works, but of course we need a lot more research to prove all of that. That said, I'll be happy to answer any questions at the end of the presentation, and Dr. Neel will take over from here. Thank you.
Thank you, Dr. Kishore. I'm not going to be the one to give you a lot of physics laws. It wasn't my strong suit. But I can tell you a lot about putting in the system and how we use it and the benefits we see. First thing is you really need to look at your facility if you're going to add one to it. And that's what we did. We added into our ICU unit, but we have a very large ICU. You're going to need quite a bit of space, and if you're like me, this was all foreign to me to start with, except that I knew enough about hyperbaric that I knew that I wanted to implement it in our practice. So we used Dr. Ron Lyman, and I've got his information in a following group of slides. And we also used a man named Fred Evans, who does hyperbaric installations for hospitals here in the human side. Because there's just a lot of information you need to make appropriate decisions. You need to know first, are you going to be able to fit it in? Do you need to retrofit anything? And if you're going to have an appropriate place for the oxygen. We decided to switch over the entire hospital to liquid oxygen. And we did that for a couple of reasons. One, it was about a third to a half cheaper for us to run on liquid oxygen than it was to run on, regular oxygen bottles. And because we have a hospital with 20 doctors and we do emergency critical care and regular practice all together. So we do a lot of surgeries. We have a lot of cases in ICU. So we go through a lot of oxygen. So in this case, we put up a bulk tank installation. And you can buy those new. You can buy used ones. You need to get with somebody that knows what they're doing about that and help you figure that out. And that's one of the things that Dr. Lyman helped us with, too, as well as the Evans oxygen. We have a large bulk tank, and it runs our entire hospital on it. My suggestion to you is get the biggest one that you can afford, because you will use this way more than you ever thought you would. And so right now, I kind of wished I'd bought a bigger one, but they come twice a week to fill it with liquid oxygen. And you need a good, stable supplier of liquid oxygen. In our case, the people drive from another city to fill ours. And so you want to make sure that they're going to be able to supply the oxygen you need. Another reason for getting the biggest one you can afford. They also make these things called dewars, which is bigger than your regular oxygen tanks, but smaller than the bulk tanks. So if your property doesn't have the ability to add a big tank outside, then you have dewars that can be just right outside your building. And that brings in that you've got city and state and national regulations for this. And so you have to figure out, depending on what kind of tank you want, what are the municipal codes for that. We had to be so far away from a property line, so far away from cars in the building. So in actuality, the cost to us to put in the oxygen source and hook it all in through the whole hospital costs as much as the hyperbaric chamber. But that's not the case with everybody, but it happened to be with ours. And these are things you don't want to make mistakes about. So you want to pick the right hyperbaric chamber for you, and you want to be able to supply it with oxygen properly. And you want technical support during and after you're in, before your installation. And the Sechrist, I went with Sechrist because they had an animal-specific one, and it was very, it had very good reviews from the people that I knew that had them, and it was, actually I thought it was real reasonably priced. And so I wanted something that I was not going to have to replace right away. And there are some things about it, you know, you can't have a spark in there, and you have to follow some rigid training to make sure you don't have an explosion. And we haven't had anything like that, but there have been in the human side and in the animal side by basically negligent on the people that were operating it. So I wanted something that everything was right with. And it, like I said, it was it was a lot cheaper than me buying a CT, I'll tell you that. And so I was pleasantly surprised at the cost. You need to expend some money in personal training. Your personnel need to know how to run it, and you don't have to send everybody to the training places out of state, but we sent two, and they're the 27th and 28th technicians that are certified in hyperbaric in the whole United States, and they were the first two in Oklahoma. So, and then after they went, while we were getting installation done, I sent them, and then about 5 of us went to the next training session, and I've got the information on where you go for training installations. But you just really have to have your employees understand the concepts and how to not cause problems to the pet and to your facility. So, and we set up some fee structures for package treatments. We give a discount of about 10% if they get 6 or treatments, or 10 treatments, or 20 treatments. And in our practice, we charge about $110 for the first treatment, $90 for the second one if it's done that same day. And we don't get much pushback from owners about it, and we're in Oklahoma. But if your staff understands the value of this, it's just like anything else. If you don't promote it, it's not going to get done. So, but we did, I think, a good job of promoting it. So, in order to improve patient outcomes, one of the reasons I got it was for pancreatitis. And we see a very good healing rate with pancreatitis. The pets eat sooner, they feel better, it's just a pain relief type of thing. And I think if you talk to people with pancreatitis, you understand how painful pancreatitis is, and deadly. So, and of course, the orthopedic surgeries, we get those, treatment before and treatment after. And any kind of traumatic injuries, the disc surgeries, and thermal burns. When I decided to do this, I have several nephews that are MDs, and they said, do you realize you're not a human hospital and you're not a burn treatment facility? And I said, yes, but, this is way more important than just those types of things. So, the longer that you use it, the more that you will see this. We just did a little here on the first year. We put ours in September of 2017, and so we did, over 1,000 every year of these. Some people do more than that, depending on the size of the practice and how well your doctors are educated to put these in your treatment plans. And you'll have to look at, sending some people to CE seminars. We also had Dr. Lyman come out, and he did, and I would highly recommend this. I had Dr. Lyman come, and we invited 50 veterinarians to dinner at a local restaurant. Of course, this was before COVID, and he gave the talk about this, and it's the first time I've been to a meeting where nobody out of 50 people got up during his talk. His talks are great, and he has a lot of illustrations. And that got us referrals and people interested, and he's well worth the what he charges, which is very good in my opinion. And that was a way to kick off our using the hyperbaric chamber. And so we did 122 average cycles per month, and that was $13,000 in revenue. The average technician time cost us about $3,000 a month. Oxygen cost about $900 a month. The cost of the chamber, that varies with where you are and what kind of chamber you get. And so we figure it brings in about a profit of $100,000 annually. And you don't have to base your decision on this based on your current clientele, because there are a lot of cities and there are a lot of states that don't have very many of these, and you can pull people in from different areas. So this is about Denali. She was a 5-month-old spayed female husky mix, and she had generalized pain, orthopedic in nature, and so we felt like she had hypertrophic osteodystrophy, and she was extremely painful, just extremely painful. And so we gave her Buprenex and IV fluids. She didn't get any relief from that. And then we put her in H-spot for 40 minutes, and 10 minutes into it, she could stand up. It was a big positive experience for our entire staff, and everybody really took notice of what Hyperbaric can do with that. And that's, basically, the pain relief and decrease of inflammation. And by the way, you can't use petroleum-based eye drops or eye ointment in the hyperbaric chamber, just as a side note. So she got out of the hospital the next day, and she has done really well. Jamaica was a really sad situation that he had been caught in a house fire, and the people lost everything, and they brought him in, and we started hyperbaric work with him. And when you see him, it doesn't look that bad right here, but he got pain meds and IV fluids, and he wasn't very happy about men and could be aggressive. So this is what the course of his hyperbaric and hydrotherapy twice a day plus pain control did. Of course, we had to debride some of this over the course of the time. But he would get up in the gurney that you slide in and get in there and just be very happy that he was in there. So it really helped with pain relief and healing for him. And so this is where he got his debridement. And it's really a sad situation, but it made him so much more comfortable. It was really a happy situation when it was all said and done. So his mama got her dog back, and so we had him for 4 weeks of hospitalization, 40 hyperbaric treatments, and a lot of TLC, and that's what he looked like at the end of his treatments. This is a very interesting case. It was referred from another referral hospital, and they had diagnosed him with Neospora caninum, and so he had neurological problems, and he was not ambulatory. So he had neuromuscular deficits, paresis and paralysis, of course, muscle wasting and inflammation. So we put him in the hyperbaric and to increase the oxygen to the CNS, the anti-inflammatory. We also did physical therapy to help with the muscle wasting and muscle memory. And with 2 weeks of intensive hyperbaric and physical therapy, he got well and got to go home. And the owners are very good advertising for us, and they thought he was going to die and he'd never get to come home, and they were very, very grateful. So there's a lot of things that you can use the hyperbaric for. As Dr. Kishore talked about, we're in a snake bite study, but we had a litter of 10 Great Dane puppies that were about 8 to 9 weeks old, and 5 of them got bitten by snakes, and they all survived, and they were treated with hyperbaric. for several days. And I just think it's a very good investment. And of course, a large practice like ours, it's kind of a no-brainer. But even if you have a smaller practice, you can draw from other places in town or around the state to have people come, as long as you get that information out to them. And like we did with Dr. Lyman, and send out advertising to the other clinics about what kind of cases that you use these for. There's really not a ton of knowledge about it unless the people have had some experience with hyperbaric in people, and they always think that that's a wound care. But it's so much more than wound care, although it's very good for wound care. So it's really something that has added a lot of interest and enjoyment to practice, and the staff likes it, and they are happy to participate in there. So, and there's Dr. Kishore, do you have some other input at this point?
Hello. Yeah, I mean, I'm good, and I've gone over all the indications, and just for sake of time, I just wanted to bring up a couple things, also things that are discussed based on questions. Certain things, for example, tumor growth, there were some concerns about, well, what happens when you promote angiogenesis? Basically, you're creating more new blood supply to an existing tumor. And we did not want to go into some of those details, but I think it depends on where you live in the world. For example, China and Japan, this is an acceptable indication even for malignancy. They use them in patients with malignant cancer. And I think they did it 2011 or 2012. There was a large literature peer-reviewed article which concluded that hyperbaric was safe in malignancy. The thing is, we know certain things about hyperbaric therapy, but there's a lot more that we just do not know about hyperbaric oxygen therapy, and that's where the mechanistic studies and what we find out will come into play. And also, the thing is, we are part of a thermal ablation study. Yes, it increases blood supply, so it could potentially spread the cancer to other sites. But there's also data in studies that shows that some chemotherapy medications, certain type of thermal ablations work better when they have oxygen, a better oxygenation. The drugs can get there better and ablate the tumor better. So I would say in the use of cancer treatment, it's pretty controversial at this point, at least in the U.S., but it's pretty safe in some of the other countries. Again, a lot depends on where you live as well, you know. And there is also, in some chemotherapeutic agent, they talk about cytostatic effects of hyperbaric as well, you know. And I think there's some papers that have tried to look and see if hyperbaric increases the effects of radiation. I'm not going to go into the details of that, but those are areas that they're trying to look at for neoplasia and how it might help with cancer growth or stopping cancers, you know. And just like the immune system, it kind of goes back and forth. You know, anytime you stimulate the immune system to do something, yes, you get your IL-1 and TNF-alpha and everything. They cause a whole bunch of inflammation. Now they heal, but then if you do too much, that can be a problem too. So I think it kind of ties back and forth between angiogenesis and increased immune system, yes, it's beneficial, but in some other places it may not be so helpful. And there is research from all across the world, from Austria, from China, from several parts of Europe, saying that it does a great deal for neurologic applications too. and I'm not sure that's a very well accepted view in the U.S. as far as hyperbaric therapy going in, and they've proved in the lab animal model and human clinical trials that it helps with acute spinal cord injury, and it has neuroprotective effects as well. So some of these indications that we talked to, some of them are well established, some of them are under research, and some of them need more work to definitively prove that hyperbaric has an indication. But that's why, as I said when we started, it's best to integrate hyperbaric into your existing practice instead of stopping what you do and saying, well, now hyperbaric therapy is going to fix everything for you. With our protocols, we include hyperbaric in our TPLOs, luxating patellas, bone surgery. It just goes as part of the package. Our infection rates are very low. Again, we do so many other things to get that low infection rate too, but this is a great adjunctive treatment modality instead of having this as a sole treatment modality. That's where we stand. And we are also participating in several other clinical trials, at least a couple others, where they're trying to see what the effect of hyperbaric would be on thermal burns, and like I said, snakebite is one, and if it even potentiates some of those chemotherapeutic agents. So with that, I think we are coming to the end of this presentation, and we'd be happy to answer any questions. And Dr. Neel said she'd like to add some more information after I'm done. I'm going to pass it over to Dr. Neel.
I'd like to tell you how you could get in touch with some of these training and consultants. There's Veterinary Hyperbaricsafety.com, and that's Dr. Lyman, and Sechrist Veterinary Hyperbaric Chambers is where we got that, and then there's the International ATMO, ATMO, and they provide the training that we went to. We went to in San Antonio, Texas. And one of our technicians that Dana, who went to and was one of the first certified ones, she also will go through Sechrist to come and help set up things for you too. I also wanted to mention to you all that in the people that have exotics, that you can use exotics, therapy and exotics for the different disease processes, wounds in exotics, bumblefoot, orthopedic surgeries. We see a fair number of exotics, and they get put in there also. So if you have a lot of exotics in your practice, or just even some, there's a reason to be able to use the hyperbaric for exotics. And I can't really emphasize enough that you need to get your staff to understand how important this is to treatment plans. That's the same thing I have with getting doctors to do dentistry and use our CT for that. Once you can get them using it, then they think it's great. But y'all probably all know as well as I do, it's hard to get doctors to have time to think about something else when they're busy all the time. And so it's certainly well worth your effort, and it will bring a good return on investment if you spend time to educate your staff. And you can do that totally in-house. And like I said, Dr. Lyman, I can't say enough for how much he's helped the progress of our use of hyperbaric. And another thing about return on investment is you don't have to just put one animal in the hyperbaric chamber. We have plexiglass and they've got to be made a specific way so they can go in the hyperbaric and not cause fires and things like that. But we can put a large dog and a small dog, or 3 medium dogs. You can run multiple dogs in the same, or cats or exotics, in the chamber at the same time. And that cuts down on your cost. So you run a cycle, and each of those animals are going to get approximately the same. Most of our treatment plans are very similar in how much atmospheric pressures that you're going to have, and the length of time. So that becomes a much more efficient way to do it. And so you're going to cut down on your cost quite a bit. The same technician can monitor them and make sure everything's going well. And it does take about an hour. There's a preliminary where it's raising the pressures, and then there's about 40 minutes of treatment, and then time going back down. So those are things that can really help you make this a profitable item for you. But you need to get everybody thinking on those terms. And
that's interesting, Dr. Neel. There was another question on that topic about someone hearing that the Sechrist chamber has a dual function and it can act like an ICU cage as well. Do you have any experience with that in your hospital?
We've actually done that, where we had a large dog and it needed more oxygen and it was more comfortable in that area. So yes, that's another use for it, and it works out really well like that. And there's just a lot of things that you'll find that you can use it for, and all of those things are profitable. The other thing is it makes your practice stand out in your area. And we last week had a near-death experience, and the dog was resuscitated, but was neurologic and blind, and we used the hyperbaric for that, and the dog's perfectly normal now. And so we know of people that have sent animals that have had near-death experiences to people with hyperbarics, and we've had that happen one other time with somebody sending us one. So once your name gets out there with it, people will start sending them to you.
Okay, great. We did have a question about using petroleum products, like polysporin ointment over the IV catheter or in the eye using lubrication. And is that amount of volume a problem? Do they need to try to get that out?
Yes, they do not need to be using that. And that's one of the reasons for going and sending at least 1 or 2 people to go through the certification process, because there's just things you would not think about. And you have to look, we put towels in with ours, but we have certain towels, and they have to be made out of cotton. And you just have to look at all the things on the towels. And so there's things like that. You can even have just little minor things. And in the training, it's both for, in San Antonio, they train both human and veterinary hyperbaric use. And it's amazing how many stories they told about people that tried to sneak things in the hyperbaric chamber with them that could have blown them up. And it's just pretty amazing, the recklessness of some people. So that's the thing that you have to really pay attention to. And so you have to have somebody that's well trained in it to teach your other people. You don't have to have everybody go.
Right. Safety first, absolutely. I know there are a couple of questions about if an oxygen generator or oxygen concentrator will work with hyperbaric oxygen chamber therapy.
Sechrist may be able to answer that better, but I believe the answer is no to that. I don't think they can get enough oxygen to it.
Okay. And then let's see. People are asking what they should look for when selecting a hyperbaric chamber, or if they're referring patients to clinics around them that offer this service. Is it like laser therapy where there are different tiers or levels, you know, or safety even to the different manufacturers out there?
I think, like I said, I was most impressed with Sechrist because they made a veterinary specific one. I have not checked to see if there are any other veterinary specific ones out there, but at the time I bought mine, there weren't. And some people buy used human chambers. However, and I thought about that. You know, I could have probably saved half the cost of the chamber, maybe. I'd still have the cost of everything else, and I wouldn't have support for this. And Sechrist is not paying me to say this, okay? It's just that I think this is something that's not your average implement or instrument to use, and you really have to have ones that are well made and they're not deteriorated. And I am unsure of who I would send to find out about a used one, you know, someplace. But I know that has been done. That's something you know, Dr. Lyman might be able to speak to you about. And by the way, if any of us all want to come to our practice, we would be happy to have you to see the hyperbaric and watch it work and that sort of thing, and what we have set up. You're going to have a pretty large place to put it, not too wide, but long, because the chamber's probably you're going to have close to 15 feet to be able to pull the gurney out, get in there, put the dog on it or the animal, push it back in, and that sort of thing. And we happen to have an area that we just move cages from that we put the hyperbaric chamber in.
Okay. What is the frequency of treatment? Is this something that you do daily?
You normally, most of them get twice a day to start with, and then they might come in and do it daily, or they might come in Monday, Wednesday, and Friday for a while. Especially if you're talking about neurologic issues. The pancreatitis ones usually get it twice a day for 2 or 3 days and then go home. You might have a single use of it for like the HOD. Well, it got 2 treatments, you know, but not a long-term coming back type issue. So it mainly,
perfect.
Yeah, it's determined by what is the issue you're treating.
Okay, wonderful. Now I think we've hit most of the talking points here, and we are running out of time. But if you have any additional questions, feel free to submit those. We'll do our best to answer any of those. I know that we have hit this in 50-minute mark for CE, so please just remember to go ahead and download your CE certificate from that yellow icon down there. And we just want to thank everyone for attending. Thank you to Dr. Neel and Dr. Kishore and Sechrist for this insightful presentation today. Download your CE certificate, and we hope that everyone has a wonderful rest of your day.